With the increasing detection of early gastric cancer, minimally invasive treatment methods have been investigated to improve the quality of life in patients with early gastric cancer while maintaining survival rates comparable to those with conventional radical gastrectomy. Endoscopic resection, a representative minimally invasive treatment for early gastric cancer, is currently recognized as the standard treatment method for this disease in selected cases. Conventional endoscopic mucosal resection, EMR, for early gastric cancer has been limited to small lesions, typically smaller than 2 centimeters, because use of EMR for larger lesions may result in piecemeal resection. To overcome this limitation, endoscopic submucosal dissection (ESD) methods have recently been developed. ESD enables en bloc resection of large lesions and those with accompanying ulcerations as the lesion is directly dissected along the submucosal layer with a high-frequency electrosurgical knife. With the development of ESD technique and the accumulation of long-term outcome data on endoscopic resection for early gastric cancer, the indications for endoscopic resection are expanding. Currently, endoscopic resection is widely used to treat early gastric cancer, and previous studies have reported excellent long-term outcomes after use of this technique. However, as the stomach is preserved and regional lymph nodes cannot be removed during endoscopic resection, various forms of cancer recurrence, including local, metachronous, and extragastric, can occur subsequently. Local recurrence of the ESD for early gastric cancer is reported to range from 0.4% to 3.7%, and metachronous recurrence ranges from 2.7% to 14%. In addition to local and metachronous recurrence, several studies have reported cases of extragastric recurrence after endoscopic resection for early gastric cancer. If these various forms of recurrence after endoscopic resection are not detected at an early stage, radical gastrectomy, which had been avoided for the primary lesion, would be required. Invasive radical gastrectomy with lymph node dissection invariably results in a severe impairment of quality of life. Moreover, extragastric recurrence can lead to a fatal outcome. To avoid these unfavorable and sometimes lethal outcomes, an established surveillance strategy is required for the early detection of recurrence. This surveillance strategy should be based on the incidence and patterns of recurrence after endoscopic resection for early gastric cancer. Recently, the Japanese Gastric Cancer Association has proposed treatment guidelines that include follow-up protocols after curative endoscopic resection for early gastric cancer. In these guidelines, annual or biannual endoscopy is recommended after curative endoscopic resection for early gastric cancer meeting the absolute indication criteria. Abdominal ultrasonography or computed tomography, as well as annual or biannual endoscopy, is recommended after curative endoscopic resection for early gastric cancer that meets the expanded indication criteria. However, the follow-up schedule still varies even among Japanese institutions, and a standard surveillance strategy after endoscopic resection for early gastric cancer is yet to be established. In the present study entitled Surveillance Strategy Based on the Incidence and Patterns of Recurrence After Curative Endoscopic Submucosal Dissection for Early Gastric Cancer, Min et al. Investigated the incidence and patterns of local, metachronous, and extragastric recurrence after curative ESD for early gastric cancers meeting the absolute or expanded indications. They suggest a surveillance strategy based on the long-term follow-up data to improve outcomes after curative ESD for early gastric cancer. Here is a summary of their findings. Background and study aims: to suggest an appropriate surveillance strategy after curative endoscopic submucosal dissection (ESD) for early gastric cancers, based on incidence and patterns of local, metachronous, and extragastric recurrence. Patients and methods. Between 2003 and 2011, 1,497 consecutive patients with 1,539 differentiated type early gastric cancers meeting absolute or expanded indication criteria underwent curative ESD. They were followed up with esophagogastroduodenoscopy (EGD) and abdominal computed tomography under a standardized surveillance protocol. Long-term outcomes were analyzed for 1,306 patients with at least 1 year follow-up. Results. Incidences of residual and synchronous lesions detected within 1 year were 0.13% and 0.87% respectively. During median 47 months of follow-up, there was one local recurrence, 0.08% early gastric cancer, and 47 cases of metachronous recurrence, 3.6% 44 early gastric cancers, 3 advanced gastric cancers. All were curatively treated. During a 5-year surveillance, the cumulative incidence curve of metachronous recurrence increased linearly. Median time from ESD to metachronous recurrence was 30 months. There were 2 extragastric recurrences in lymph nodes at 5 and 4 years, respectively, after curative ESD for absolute and expanded indications. The patient with the expanded indications underwent a palliative operation and died of gastric cancer progression. Conclusions. There was a constant incidence rate of metachronous recurrence after a 5-year surveillance period, and there was extragastric recurrence at least 4 years after ESD of early gastric cancer, even for absolute indications. Therefore, annual or biannual surveillance EGD and abdominal CT might be necessary for at least 5 years after curative ESD for early gastric cancers with absolute as well as expanded indications.